thank you. That was great. Now we will be moving on to our next speaker. Okay, so our next session centers on the execution of psychiatric infrastructure and healthcare leadership. He is a consultant psychiatrist and head of department of the intellectual disability CAG at the Amal Psychiatric Hospital here in Dubai, and serves as an adjunct clinical professor across both Gulf Medical University and Mohammed bin Rashid University. With over 20 years of clinical and academic mastery spanning both the UK and the UAE, he has served as an examiner for the Royal College of Psychiatrists and the General Medical Council in the United Kingdom. To discuss a historic milestone in regional medical infrastructure, again here in Dubai, I'm honored to welcome our esteemed guest speaker, Dr. M. Deepak Thalitaya, to speak on the conceptual and development of the UAE's first intellectual disability service. Again, it's pre-recorded because he was unable to make it this specific time. And I will be sharing the video now. Just a moment. Okay, if you can all, see my screen, I will begin the video now. Let me just mute myself.
Good evening, everybody. Thank you very much for joining. Thank you very much for inviting me to speak today. Very well done, Zara and Zareen, for organizing what is a very pioneering neuroscience conference. And I think no doubt this will be a start of great things to come. So without further ado, I know we don't have too much time, so let's focus on what I'm going to talk about today. My name is Dr. Deepak, consultant psychiatrist and head of department for intellectual disability psychiatry. What I would like to do today really is to try and talk a little bit about my journey in one aspect of neuroscience, try and give you a flavor of what intellectual disability is all about, and put this into the context of the UAE setting. Very briefly, so I am from India. I studied and worked in India. I subsequently went to the UK for specialist training in psychiatry and then senior fellowship training in intellectual disability psychiatry. I spent about 25 years in the UK in various roles across the country. I moved to the UAE about 7 years now on behalf of the UAE government to set up the UAE's first intellectual disability psychiatry service. Okay, so very briefly about ID, let us try and touch base on what it's all about. Intellectual disability, basically around 1 in 7 people around the world will have some form of disability. Many of them live in low socioeconomic countries without access to healthcare, and very few countries around the world actually have established ID services. And this is really on the back of limited understanding and awareness of the condition, little understanding of management and intervention, and lack of skilled staff for services and resources. So what it is all about, intellectual disability, really trying to make it very concise, really, there's 3 basic diagnostic criteria. We're talking about people with an IQ of less than 70. The problems started before the age of 18, and ultimately, although the name says intellectual, it is really about their inability to carry out day-to-day or what we call socio-adaptive functioning. Okay, again, very, very briefly, there are about 4 grades of disability: mild, moderate, severe, profound. The worse the degree of disability, the less they can do and more support and supervision they need. This is what I call the triple jeopardy. People with ID have a much higher rate of both physical and psychiatric illnesses, much more than the general population. They have a much higher rate of mortality, not 1 week, 1 year, 1 month, but about 15 to 20 years lower lifespan than the general population. The third one is materiality. The cost of looking after somebody with an intellectual disability is anywhere between $1 to $3 million US. And obviously, this is a significant financial burden on people looking after them. If we talk about impact factor, there's significant issues people with ID face, both in terms of biological, there are lots of ethical conundrums, professional issues. Many of them don't have the same access to human rights and societal equality and so on. Many of them end up in criminal justice and forensic systems as well. So they have a lot of issues, and this is not just the patient, but also the systems and environment and people around them as well. Okay, again, just a very small, very recent example. If you talk about the COVID-19, people know that people, elderly and those vulnerable, had higher risks, but people may not know that one of the highest rate of mortality was people with intellectual disabilities. And no doubt, all of this places a significant burden on carers and the society around them as well. This is one point I'd like people to think about, which is called diagnostic overshadowing. What it means really is there can be a conundrum in terms of, when you see somebody with ID presenting with certain issues, and it's very difficult to try and understand, is this a clinical issue, a medical issue, a psychiatric issue, a social issue? And this is what we call diagnostic overshadowing. And without getting to grasp of this, it's very difficult to understand what you can do to help this patient. I just want to talk about what we call the euphemism treadmill. Although I use the word ID now, people with intellectual disabilities have been called very derogatory names in the past, even officially. So idiots, moron, imbecile, all of these words were used to describe people with ID. And again, if you talk about the history, they were used or called freaks, for example. There were laws in the USA, for example, which was called ugly laws. People with ID or disability should not be seen in public. People would have heard about lunatic asylums where, 2, 3, 4,000 people would be staying in what were called asylums in those days. Not very nice, I must admit. There was also the eugenics movement, so positive and negative eugenics movement to try and wipe out this group of people or wipe out this genetic lineage, for example. In the World War II, there was what was called the T4 euthanasia program to actually eliminate and exterminate people with intellectual disabilities. Even if you talk about it today, people with ID are significantly burdened. Many of them are living far away from home. Many of them end up restrained. Many of them having psychotropic medication given to them against their will. If you talk about a kind of vulnerability, many of them are subject to all forms of abuse, whether it's kind of physical abuse, sexual abuse, financial abuse, emotional abuse, all of these things, very, very common in this group of people, really because they don't have a voice and the families around them cannot and don't have access to same recourses as the rest of us do. Okay, I'm trying to rush through, so let us talk about the current context. In the UAE, there's very little services, or there was very little services, like most countries around the world. Many of you would have heard about the concept of people of determination. This is UAE's attempt to put a positive spin on what can be seen to be quite a negative terminology. Some of the other words have been, for example, mental retardation, and so on. So this is a positive spin on this terminology. I won't go into too much detail, but people have heard of the people of determination legislation, and there are many others the UAE has put in to try and empower and give this group of people and the families looking after them access to support systems. Okay, there's some more examples there. Very briefly, Amal Hospital is the oldest psychiatric hospital in the UAE. It's the largest psychiatric hospital in the UAE as well, and the only psychiatric hospital in the UAE, founded in 1983. We went up significantly in numbers. We now have about 214 beds overall. I came in about 6 years ago to set up the first ID service in the UAE. We went from having absolutely nothing at all to now having inpatient units, both male and female. We also have the first outpatient service for people with ID. We have over 1,500 people with ID in our clinic. We also opened the first rehabilitation villa for people with ID in the UAE as well. And part of this is not just the kind of material aspects, but it's also about collaborating, networking, harnessing with local stakeholders, people that matter. And one of the joys of people working in this specialty, really, it gives you such a multidisciplinary, holistic approach. We can talk about psychology, occupational therapy, speech therapy, physiotherapy, for example, lots of multidisciplinary working. As part of our service, we did a lot of innovation. So, for example, home delivery, virtual consultations, for example, for people who can't come in, lots of education, awareness, teaching, training. For example, we had the first International Day celebration. People will recognize the frame. This was lit up in blue in honor of this group of patients and the services that look after them. We do a lot of work in terms of medical legal aspects, particularly on guardianships and capacity, for example, a significant amount of work in terms of awareness, newsletters, brochures, educational leaflets, for example. We have a wide range of teaching and training for medical students, nursing students, psychology students, for example, social workers. We do a lot of academic teaching sessions as well. And really, we're very proud to be the only and first ID service, not just in the UAE, but what I understand to be is the wider GCC as well. So this is a significant really step in terms of trying to build this group of people in the neuroscience world. I'll end here really to try and say that a career in psychiatry of intellectual expertise is like no other. Really, it gives you such a kind of fulfilling, really, and high impact kind of joy to kind of your vocation. A lot of advocacy. We speak on behalf of some of the most compromised, vulnerable people in society. We support people, families through their journey of having this condition. A lot of opportunities in terms of employment, and research, for example. So really, it's very, very wide. There's a lot you can go through here, really, but I'm trying to condense this all in a few minutes. So that's it for now. I hope this was useful to give you a brief overview of RD, my journey, and really the kind of the challenges, but also the positives and opportunities to look forward in this field of neuroscience. I'll finish here. Thank you very much for listening. I will have my contact details if people want to contact me for any guidance or counseling or support in this field. I would be most happy to do so. Once again, hearty congratulations.
Okay, so thank you to Dr. Thalitaya for sharing those vital blueprints behind those groundbreaking systems. Now, let me just share my screen.